And that was my next question to you is, do you find that you meet a patient and then actually bring hope to the table because there's more treatment options available than they may have initially thought? Or are you the kind of bearer of bad news where often clinicians have given often false hope? Oh, we're surgeons, we can cure you, we'll cut this out. And then you're the one who actually said, well, they did remove the tumor, but actually the lymph nodes are involved, or your scans show that there's disease elsewhere that we weren't expecting, and it's not good news that surgery alone was completely curative.
Yeah, I mean, the answer is yes, both. I mean, there are times that the message we have is better than either the patients heard or they thought, and there are times, sometimes the message is worse, or unexpected, that we're going to recommend chemotherapy when they thought they weren't going to get, when they were told that it was all gone. So people do bring in different ideas and different concepts. So I like that open-ended question. Advice to patients would be to go in with that kind of open-ended approach both ways so that we know what our expectations are.
And it seems fair to say that most patients that you're meeting in the clinic have already accepted that they do have a cancer diagnosis. We do sometimes see a situation where a patient doesn't know and the family are encouraging us not to tell an elderly relative that they don't use the C word, which I think can actually make conversations quite difficult.
Very. And culturally, we also see that different regions of the world, you don't talk about it to the patient. The family deals with it, or we're protecting them. Yeah, we try, at least here, as much as possible to break that down. As an oncologist, it's not often we tell a patient for the first time they have cancer. We often will tell them things are back or worse, but I realize that others have to do that, those that make the diagnosis, who really, for the first time ever, tell them that they have.
And we'll be putting Dr. Bayezi on the spot shortly to talk about the surgical issues. You've talked already about the importance of the team, that it's not just you and the patient, and that these conversations not only take time, but we know that many cancer patients, when they're given information, there's numerous studies that have showed that patients retain less than 10% in that initial meeting of the information that they're given, and it's so important for patients to take a loved one, a second, third, fourth pair of ears. How important is the multidisciplinary team, not just in terms of treating patients, but in re-emphasizing what you've said, maybe packaging it in a different way and sitting down and maybe a different style? Right. You use oncology nurse practitioners in the office?
We do. I mean, we have all sorts of different people who help with the information and have their roles, and each practice is a little different about how they divide that up. Particularly when we work as a team, when we're used to working together. I have a sense what's already been told to that patient. A lot of times when I don't know the referring physician or things that have happened beforehand, I'm less sure. So you do want to make sure, engage that. We're going to use every element of our team, provide written information. We will frequently send patients to websites and the like to do deeper dives, because there's so much on the internet. We almost prescribe specific websites that we think are of good quality. You hinted at it, but having the other set of ears on the other side is really important. Our first visit, there were only 4 ears, your 2 and my 2, in the room, if I remember correctly.
You're right. But what I did request was whether I could record it. And I really appreciated that you said, have at it.
Yeah.
And so I know that I recorded the first 2. Now, when I went to Dr. Bello, both before and after, I took my daughter with me to be an extra pair of ears. Yeah. And found that extremely important, because she was reminding me afterward. Because, you know, even though you think you're in charge of yourself, you're not. And so my daughter remembered things that I had not remembered.
And did you go back and listen to the recording?
Actually, I never did. And it seemed that because I was recording, I was remembering better.
Right.
But I was glad that you were very comfortable about me recording it.
Well, I'm interested now that I've been a patient. My wife went with me to our key visits, and even then, I'm like, I'm a doctor. I know what the person's saying, and what she wrote down is completely different from what I heard. So I think on all of these important doctor visits, it's great if you can to bring a second set of ears.
Oh, yeah.
Well, we always know the girls ask the best questions.